5 decades now. This was how we stepped into community ophthalmology. But as the years went by, we found that the screening camps are not sufficient. They are good for picking up cataracts, picking up refractive errors, bringing the patients to the hospital and treating. But we need to do a lot more work if we have to go into the other major sight-threatening diseases of the eye. No financial interest. This is the tertiary eye care facility which I have been talking about. This is Little Flower Hospital and Research Center at Angamali. This is situated close to the Cochin International Airport at the junction of the two major highways of the state, that is the National Highway 47 and the State Highway number 1. And it's well accessible by road, rail, air and sea. We have accessibility of the patients. The underprivileged patients approach the hospital either through an outreach camp or they walk into the hospital. The outreach camps have been going on, as I said, for the past 5 decades. Walk-in patients are assessed by the administration whether they are come under the category of the underprivileged and they need, in fact, the support of the hospital. Any patient who walks in with a below poverty line ration card is considered as an underprivileged. If they don't have it, a letter from the local panchayat or municipality authority is considered as good. And a letter from a religious leader, maybe a parish priest or a person of good standing in the society, a political leader who is known in the state, is considered as an underprivileged. Why do we need these outreach camps at all? Because nowadays we have the pyramidal model where we start from the vision centers and go up to the tertiary care and to the center of excellence. But in a state like Kerala, it is highly literate, but still the patients, they still find it a bit, many of them don't approach the hospital for their problems. They don't take the healthcare as the rural population, they don't take healthcare as a priority. So blindness of any form is a serious problem, posing serious questions regarding meaningful existence, and it impacts all areas of life, severely impacting the quality of life. In such a scenario, programs designed for and managed by the local communities play an important role in reducing the prevalence and impact due to blindness. Our community outreach programs are aimed at providing medical services in the community. We maintain high quality, large volume and sustainable health program. This also improves the health-seeking behavior of the population and create awareness about diseases like diabetic retinopathy and glaucoma, where these diseases, as everyone knows, are sight-threatening only once it's in an advanced stage. So it's very important to pick up these diseases at an early stage and initiate treatment. And these patients are referred to the tertiary eye care center. The materials and methods, what we need in the eye camps, this is a cross-sectional survey and prospective population-based interventional study where more than 1 lakh people were screened. We had 584 free outreach cataract screening camps in the 5 districts of Kerala from May 2009 to April 2013. This is the age-wise distribution of the population. Maximum were in the 60 to 80 age group. 30.2% of the screened people were eligible for cataract surgery. Coming back to the tertiary care facility, I'll take you through the quick tour of Little Flower Hospital. This is the facility which we bring the patients to. This is our registration, the various specialty clinics, the optical shop, and this is our non-paying wards. In fact, we provide all of them beds with mattresses. We have a low vision clinic, the eye operation theatre. We have a complex of 8 operating rooms with all 1 room, 1 table concept, and all we have is a separate entry for the paying and the non-paying patients, but all of them are treated in the same operating room. This is the reception for the operating room. We have an eye bank facility where we harvest more than 1,000 corneas every year, almost 30% of which we transplant in our own hospital, and the rest we transport it to the various hospitals within the state and outside the state. And this is our pharmacy. So how do we do the funding? The infrastructure of this hospital is almost half of it was through our own funds and half from the non-governmental organizations which funded our hospital. And the running expenditure is our own, 100% our own, which is subsidized by the hospital from the revenue which we generate from the paying patients. the non-governmental organizations in eye care, these are service organizations, they are donors interested in eye care in India, and even the Vision 2020 nowadays promoting a public-private partnership. The international NGOs which have helped us in bringing up and maintaining this hospital are the Christopher Blinded Mission, the Operation Eyesight Universal, the Orbis, the Sight Savers International, Rotary International and Lions International. Yes, I'm sure that we get support and we work in partnership with all these organizations at the same time without having any conflict of interest between these organizations. Each of these organizations have their own priorities, have their own interests, and we always try to satisfy their priorities when we take help from them. CBM is a German organization. The primary purpose is to improve the quality of life of the world's poorest patients with disabilities and those at risk of disability. In fact, we were known as the CBM Eye Institute for a long time when we had a building which was supported by the CBM. Recently, we moved to a new facility, and the pictures I took you through are the pictures of the new facility. The CBM, it has its regional offices offering training measures and assistance in human resource development as well as professional and management skills. It has seconded experts providing professional assistance to the project staff and other specialists in the country, and they have advisors who visit the partner organizations and their projects and give professional recommendations in accordance with the CBM's policies. So these people, they keep on visiting us on a regular basis and give us inputs about their policies and what they expect out of us, and we also try to match their expectations. Operation Eyesight Universal is one other major partner which we have. This is a Canadian organization. The declared objective of this organization is prevention of blindness, and this particular organization works with partner organization. In fact, our new hospital facility is supported to a major extent by Operation Eyesight Universal. The OEU, in fact, helps us to establish diagnostic and treatment clinics that go into the underserved areas and serve hundreds of people. They also have their interest in nutrient and hygiene education, which is more relevant in the backward areas, the backward states and the backward districts of India than in Kerala, and also in places like Africa where even the primary healthcare facilities are not available. They provide an impetus for community action such as education people about waste disposal, sewage and drinking water, immunization programs, and also they give non-formal education, micro-business skills, and in fact it's a program which helps in touching the lives of so many people, not just eye care. Orbis International is another organization which helps us, which supports us, with which we have partnership with. This has its headquarters in New York. The stress of Orbis International worldwide is childhood blindness as well as corneal disease and eye banking and diabetic retinopathy. And for us, for Little Flower Hospital, we have a partnership with Orbis in pediatric ophthalmology. This is the icon of the Orbis International. This is the Flying Eye Hospital of Orbis, and this is the operating room within the Flying Eye Hospital. The India Childhood Blindness Initiative was started by Orbis International, and the target was to set up 50 pediatric eye care units by 2012, which has been attained. And the Orbis has trained the staff and provided equipments for these pediatric eye care units. Now the secondary objective of this particular NGO is establish training centers from selected centers which they have established. Sight Savers International is a UK-based NGO which helps in integrated education. As for us, the partnership with Sight Savers International has been in training process, both for small incision cataract surgery as well as ROP training. Rotary International provides matching grants wherein a local Rotary will have to come up with a project and raise funds, and the same funds will be raised by Rotary International. Lions International helps with cataract surgeries, capacity building, and the Lions Aravind Institute of Community Ophthalmology is a standing monument of the support which Lions International has given in India. The apex body for all these is Vision 2020, which envisages public-private partnerships in this field. And for our hospital, we got a grant way back in 2005 from the President of India for about 2 lakhs rupees. This was to provide free spectacles for children with refractive errors. And many of our patients who come to the hospital are underprivileged. They don't have the money to go through the specialty treatments, be it corneal transplant or retinal diseases, retinal surgeries, if they are to pay the regular hospital rate. And it's our policy not to send back any patient for a lack of financial resources. So the hospital, in fact, supports these patients through our own subsidies. And on a personal basis, many of these patients who come to me with these diseases, in fact, many of them are referred by people from the society, like religious leaders, parish priests, politicians. And I've been able to strike a rapport with many of these religious leaders. If they send a patient for a retinal surgery, the hospital will give a 50% concession to them, and the rest 50% I ask the person referring, the parish priest, for example, to raise the money. And this has two advantages which I have seen. They raise the money for the treatment of this patient, and at the end of the treatment, the parish priest calls me back, I have raised 40,000 rupees for this patient. Yeah, you needed only 15,000 for this patient, so I have 25,000 left with me which can be utilized for some other patient. So this is one nut which we could crack, the religious leaders. The second nut, the politicians have not been able to crack so far. So to conclude, you always work on a project, convince the NGOs with your track record, do a good reporting, do a strict maintenance of accounts and trustworthiness. That's all important in sustaining such a facility. Before I conclude, the Vitreoretinal Society of India is conducting its next annual conference in Kumaragam in December 2015. I invite all of you to this conference. This will be a mega event. Thank you.
Thank you, Dr. Thomas Cherian, for this excellent presentation. I think